Hi all, welcome to exam preparation part 13. If you have not completed the previous exam preparation videos, please watch it in this channel for the continuity of topics. Today's topic is diseases and investigations part 2. Part 1 is already uploaded in this channel. If you didn't see it till now, please watch it today itself. The topic is prepared from important and frequently asked questions in various central government exams. Same as in other exam preparations, this video also has 3 parts. First one is multiple choice questions, second one is topic presentation with animation or features, and the third one is memory tricks and tips. Let us go to the multiple choice questions now. Read each question carefully and choose the right option. The answer key is given here. Please check your answers and redo the exam till you get 100% of the result. Now, let us go to the topic presentation with pictures and animations and tables. Romberg test. Romberg test is done to examine neurological function for balance or proprioception. Rorschach projective test. This is a psychological test in which subjects' perception of in-bloats are recorded and then analyzed. This test used in schizophrenia, personality disorders, and in intelligence test. Rothera test. Method of testing urine for presence of acetone. Red reflex test. Examination of pupil reflections. Used to detect visual deficit in young children. See the diagram to differentiate normal, absent, and abnormal reflexes. Rubin's test. It is dilatation and insufflation. This is a diagnostic method for determining whether the fallopian tubes are occluded or not. Simon-Binet test. This is IQ test generally used to determine an individual's intellectual functioning. Sulkowicz test. This tests the presence of calcium in urine. Schilling test. This test is to evaluate vitamin B12 absorption in pernicious anemia. Schick's test. This is diagnostic test for diphtheria. Trendelenburg test. This is the test to determine competency of valves in veins of legs in varicose vein. Thematic apperception test. A projective psychological test in which pictures of life situations is shown and assesses insight into client's personality. Watt test or the vestibular auto-rotation test is a test to subjectively evaluate VOR, vestibular ocular response, and its function. VDRL test, Venereal Disease Research Laboratory test, is a screening test for syphilis. Vidal test. This test is done in typhoid fever or enteric fever. Weber test. This test is to evaluate hearing loss with a vibrating tuning fork in middle of the head. If normal hearing, equal sound in both ears. If conductive loss, sound heard in abnormal ear. If sensory loss, sound heard in normal ear. Runner's test. It is used primarily to evaluate the loss of hearing in one ear. It compares perception of sound transmitted by air conduction with those transmitted by bone conduction. See the diagram for fork position for Weber and Runner's test. VMA test, vanillyl mandelic acid. This screening is done in children for catecholamine secreting tumors such as neuroblastoma, pheochromocytoma, etc. Clay-Hove test to determine if there is fetal blood in maternal circulation. Acetic acid test. Acetic acid test is done to detect albumin protein in urine. Now let us see about some memory tips and tricks for connecting the topics. This will help you to avoid confusion about various options in exam hall. Now let us go to some memory tips. Acetic acid test, albumin in urine. A is highlighted. Romberg balance. B is highlighted. Rorschach psychological analysis. CH is highlighted. Rothera acetone. A is highlighted. Rubin's fallopian tubes, UB is highlighted here. Weber hearing middle fork, Rinner hearing one side fork. So compare the fork position and remember the diagram for Weber and Rinner test for hearing. Clayhorn fetal blood in maternal circulation. Simon Binet IQ, Sulkovich calcium, Schilling's B12, Schick's diphtheria. Then VDRL syphilis, Vidal typhoid, VMA tumors. These all are just some memory tips for memorizing the topics in exam hall. Please practice your own memory tips and tricks for avoiding confusion in exam hall between similar options and core good marks. Thank you all for watching this video. Please add your valuable feedback. Subscribe this channel for more exam preparation videos. Thank you so much.